Hello, thank you for choosing Home Health Resource Group, or HHRG, as your home healthcare provider. HHRG manages a network of Medicare-certified home health agencies across California. We are happy to be here with you in your journey back to good health. But first, let me tell you about HHRG's COVID-19 patient care guidelines and what we are doing to help keep you safe from infection. HHRG is monitoring the coronavirus or COVID-19 outbreak daily, and the health and safety of our patients and employees is our top priority. Our clinical team provides the highest standards of infection prevention practices, as recommended by the Centers for Disease Control and Prevention, or CDC. Our team is focused on emergency preparedness, caring for our existing patients, and accepting new referrals for patients with COVID-19, obtaining necessary PPE supplies to keep our clinicians safe, and following CDC recommendations and care guidelines to safeguard and support our employees, patients, and the community. Prior to home visit, our office will determine the skills and services required by the patient. The assigned clinician will have a checklist of supplies and equipment needed to perform the home visit. The clinician will contact patient or family to provide visit expectations and briefing on home situation and protocol for infection control. The clinician will perform COVID-19 screening. During patient visit, the clinician will arrive 15 minutes early for PPE setup and infection control preparation. Announce arrival from the outside of the patient's home. Ensure a safe environment for both clinician and patient. Inform patient of the visit, steps, and procedure. Observe infection control protocol at all times. Execute the care plan. Focus on the tasks at hand and will not accept phone calls at this time. After patient visit, the clinician will discuss instructions with patient and/or caregivers, advise patient and caregivers to expect follow-up call from our team, provide contact number for patient and caregivers for any concern they may have, perform disinfection procedures for supplies and equipment used. HHRG's Personal Protective Equipment, or PPE guidelines. Expect your visiting clinician to follow these guidelines on wearing PPEs. Your clinician will wear a full PPE gear, which is a set of gown, goggles, face shield, face mask, and gloves. When the patient tested positive for COVID-19, the patient shows symptoms of any respiratory illness, the patient was exposed to a person who tested positive, your clinician will wear a face mask and gloves when the patient tested negative for COVID-19, the patient has no symptoms of any respiratory illness. For our patients' safety and peace of mind, at HHRG, our patients come first. Our goal is to provide utmost care in the safety of your home and assist you as you recover, thrive, and get ready to go back to your independence and community. In light of the evolving COVID-19 situation in the U.S., we understand you may have questions about what HHRG is doing to keep you safe. We have gathered frequently asked questions, FAQs, and answers to learn more about COVID-19 and what we are doing to ensure your safety. What is the novel coronavirus, or COVID-19? It is a new coronavirus that was originally detected in Wuhan, China, that has become a global pandemic of respiratory disease spreading from person to person. COVID-19 can cause mild to severe illness. Most severe illness occurs in older adults. What are the symptoms of coronavirus? There are a wide range of symptoms of COVID-19 reported: fever, cough, shortness of breath or difficulty breathing, chills, muscle pain, headache, sore throat, new onset of loss of taste or smell. What precautions should I take to avoid getting sick? Wash your hands often with soap and water for at least 20 seconds. Cover your cough or sneeze with a tissue. Don't touch your eyes, nose, or mouth, especially with unwashed hands. Avoid close contact with individuals who are showing symptoms of illness. Stay home if you are sick. Wear a face mask if you need to go out of the house. How is novel coronavirus spread? The virus is spread mainly from person to person, between people who are in close contact with one another, from respiratory droplets produced when an infected individual coughs or sneezes. How soon after exposure to coronavirus do signs and symptoms occur? Symptoms occur anywhere from 2 to 14 days after exposure to the virus. Where can I go for more information on coronavirus? Please reach out to your Hhrg clinician with any questions. For real-time updates on the coronavirus, please visit www.cdc.gov. What is Hhrg doing to keep me safe? Hhrg's clinical team practices highest standards of infection prevention, as recommended by the Centers for Disease Control. We consistently educate our clinical staff and provide oversight to ensure that they are following all the recommended standards. Our employees are educated not to come to work if they are sick, and to use personal protective equipment, gloves, surgical masks, when caring for any patient with signs and symptoms of respiratory illness. All employees are now wearing cloth face coverings when providing care to all other patients. Hhrg employees are provided with education and support to recognize signs and symptoms of COVID-19. Employees are also self-screening for symptoms prior to the start of any patient visit or shift. We are encouraging patients to notify their Hhrg clinician if they or someone they have had contact with have recently traveled internationally or had exposure to someone with COVID-19. We have established processes to facilitate communication and to provide daily updates to all of our offices and employees as the situation continues to evolve, to keep you and your care providers safe. Hhrg is committed to provide quality care while we keep our patients safe at home. Your clinician is with you right now. Please do not hesitate to ask any questions about COVID-19 and our commitment to keep you safe and healthy. Or call us for any questions or concerns at 1-877-232-0807. Please sign the confirmation form that you have been provided information about COVID-19 and what Hhrg is doing to keep you safe and informed.